I am very happy that we have Dr. Aldrich with us today and speaking about vocal techniques for aging voices. I am, Dr. Aldrich and I was saying to her yesterday, we're often like ships passing in the night because she's the chapel choir director here at Princeton, which is an incredibly impressive program with many things they do, a really large choir. My next door neighbor, Kenny, is the head electrician here at Princeton, and he sings for Nicole and her choir, and it's and so when I don't see you in passing, there's always talking to Kenny, and he's talking about you and Eric, and he got back from tour from Greece with Nicole, and and Princeton is such a great musical world here, and I'm so happy to be able to have Dr. Aldrich and Gabriel and Tim and Dr. This is such a kind of a powerhouse of knowledge and information and experiences. And I was trained as an organist, and I sang at Westminster, and I know a little bit about vocal technique, but that's certainly not my area of expertise. So I am really happy to have you lead us a little bit and teach us. Learn and apply to all of our programs, whether churches, schools, or community choirs, etc.
Thank you very much. Thank you. Yes, Peter said my name is Nicole. I direct the chapel choir, and I'm actually starting my 24th year of working with collegiate choirs. So I've worked with that. I love that 18 to 25-ish age group. They're really wonderful people, and I learn something every day. Up until I started this job here at Princeton, in the chapel where we have a Sunday morning service, I always also had a church job. And I've been doing that actually for longer. And my church choirs have always been sort of the trenches. The first church choir I had 8 people in it. And they've been bigger. They've not been smaller, thank goodness. One thing that they have in common is that they tend to have slightly older singers in them. So if you are a church choir director now, then you may have already seen what I'm talking about. If you're not, someday you might be, and this could be useful to you. No matter what, we're all going to be aging singers someday. So I think this is maybe a useful conversation, even if you run into it again 50 years from now for yourself. So I have handouts that actually are basically the outline that I'm speaking from. If you get annoyed by someone who reads to you from something you have in your hands, then you don't want one. If you do want one, I'm not going to read it, but if you do want one, you can raise your hand and then I'll find out who gets annoyed by these things. All right, right on. I'm not looking, so, whatever. I always I don't like leaving presentations myself and feeling like I took this note, I have no idea what it means, or even just to have something to scribble notes in while we're talking. So I call this Care of the Older Voice Toward Lifelong Singing. But I was in the car on the way here, having already printed these, including with run date, and then I realized, I really should have called this Care of the Older Singer, because when we're dealing with an older voice, we're actually dealing with an entire package of a person, right? And I'm sure that you have spent some time kind of exploring what that means already. So when I approach this topic, I tend to think of 3 main considerations, and those are what's going on physically, and then the emotional and intellectual and social aspects of aging that are really quite important. And then, in addition, some of the musical aspects that we can deal with as choir directors all the time. And I do take a sort of good news, bad news approach as I go through these. So definitely going to start with the bad news. I feel like that's the right way to do this. So talking right off the bat about the physical changes that will affect the voice or can affect the voice as one ages. Muscle wasting, and this is a full body syndrome, right? Muscle wasting is also known as sarcopenia. If you don't do anything to keep the muscle that you have now, you will lose up to 50% of your total muscle mass by the time you're 80. So we talk about strength training quite a bit. It's very, very important. I think like my mom, My mom's in her 70s, and she's a walker. She walks and walks and walks and walks and walks. I'm like, Mom, would you please pick up some soup cans? You gotta, please pick up a gallon of milk, although she's doing that as well. But really, those muscles, they will waste away on their own. You've got to be working to add them, right? There's a larger syndrome. A syndrome is just a collection of symptoms, right? Called frailty syndrome that can affect our singers. Weight loss is one of the symptoms, exhaustion. Muscle weakness, slowness while walking is also a symptom of this frailty syndrome. And then in general, just low levels of activity. You may know some older people like this, right? And they are frail. They get kind of bird-like, and you know what I mean. I put an asterisk by weight loss and exhaustion because those, at least in one particular study, seem to be the ones that impact the singer's impression of their singing voice the most. So they asked a group of people with frailty syndrome to fill out an assessment of what they call their voice handicap. How difficult is it to sing, to speak, to do what you want with your voice? And weight loss and exhaustion seem to correlate the most with a negative view of their vocal ability, or with a low self-assessed voice handicap, shall we say. Muscle weakness also may have correlated, but the thing about muscle weakness when they test it in the doctor's office is that they use grip strength. And grip strength and singing don't have a whole lot to do with each other. So it could be that there's muscle weakness here or here, but not here, that could also be affecting people's assessment of how easy it is to use their voices. So that frailty syndrome is something that happens to people as they age potentially, right? These are all potential, which is the good news, so hold on. Reduced vital capacity in the lungs, right? Vital capacity is what you can inhale and exhale, right? And so efficient oxygen use also declines by 1% a year, partly because the expiratory muscles aren't as strong, the muscles that are involved in moving air out of your lungs. So the muscles of the abdomen and the back and the muscles in between the ribs as well, they just get weaker, and so they're not able to move air out of the lungs. And if your lungs aren't empty, it's very hard to get more air in, right? So that's an issue that can happen. Certainly changes in balance, posture, coordination, right? You've seen women and men, really all genders kind of can develop this as they age, right? This sort of, the hump in the back, certainly changes in balance. You know that older people are susceptible to falling sometimes, right? These are all potential things that can happen. The vocal folds themselves change, right? Vocal folds they're actually, people used to call them vocal cords, right? You may have heard that before or even used the term. Kind of gives you the impression that there's these two strings and they kind of, vibrate on their own here, right? But really it's a larger fold of muscle. It's still within this little tiny larynx, which is the size of, it's the circumference of a nickel. If your voice developed with testosterone influences, and if your voice developed with estrogen influences, it's maybe the size of a dime. It's a very small little instrument in here, right? But if it were really big, then you could imagine that it's got a muscle here, and then kind of a little cover over top of it. You got one on this side, and then you got one on this side, muscle with a little cover over top of it. And what they do is they vibrate together, okay? So, and they vibrate pretty fast, right? A440, right? It means that it vibrates 400, that when you hit it on the piano or you play it on a string instrument, it goes through a single vibratory cycle 440 times in a second. That's true of your vocal folds as well. Okay, so they come together 440 times a second when you sing A440, right? They don't just come against each other. Right now I'm showing you, believe it or not, I'm showing you a cross section, right? If you were looking, if you were able to kind of slice me this way, you could see the vocal folds in their full thickness, or their full, depth, up and down here. You see them coming together, but what you also see is that they kind of make this cool ripple against each other. So now I'm gonna do just the edges for you. They go like this as they come together. So they go through this really cool cycle of opening and closing, not just this way, but from bottom to top and then bottom to top again. Really cool, super cool, yeah.
So you're saying that the cross section actually looks like this, it's not like this? Because I've always pictured the air coming out like this. And
right, okay, so yeah, actually you just turned it 90 degrees from what I was showing. Right, so yeah, no, absolutely right.
Okay,
you think of it this way, yeah, the air comes through.
Okay.
So the air flows underneath from here, from this picture. Airflow's coming underneath. It opens them at the bottom first. Obviously, here's air coming up from underneath, right against my closed vocal folds. They're gonna open from the bottom first, because that air pushes them open, right? And then they go through this sort of, they ripple open, lets air out, air gets, then we've got air pressure that's higher up here than it is down here, and it sucks them closed again. And then they go through this cool little opening, closing cycle that has to do with air pressure above and below. And other stuff too, but I don't have a whole semester. At my last university, I taught a whole semester class called The Science of Singing, and it was for non-singers. And it was so much fun. It was really fun, because I was like, okay, somebody tell me about Boyle's Law. Somebody tell me about the Bernoulli effect. And they're like, me. Okay, I'm gonna write that down, what you telling me. Right, anyway, so you've got these things. It's a very sophisticated little tiny instrument in there, right? And so we've been talking about muscle. We've been talking about the way this muscle moves and the cover on the muscle, cover on the muscle, right? The way that these things move and work together. Apart from the vocal folds, you've also got other muscles that will control how firmly they come together, how thick they are, or how thin they are when they come together, what the cartilages are doing also. They've got cartilages in there. It's a mess. Very cool though. Watch some videos. It's very, very cool. Anyway, it's sort of important to understand, at least to understand how intricate this instrument is, so that you understand what it means that these vocal folds that we're talking about, they will stiffen, they will thicken, and they will deteriorate over time, potentially, right? When you've got changes in the muscle of the vocal fold, that can cause them to bow, where a singer might used to be able to have, okay, now I'm doing a different model, still you're looking kind of down my throat, right? Here's vocal folds, right? Now they're touching, right? Because I'm making a sound, and they're vibrating really fast, faster than I can do with my hands, right? Opening and closing, okay? But there is a point at which they close. Ah, that's closing and then opening, okay? When you've developed bowed vocal folds, the muscles have weakened to the point where you no longer can get them to close. It's actually bowed open, okay? And so you get a sound like, ah, right? Because you're getting incomplete glottal closure, they like to say that, right? The glottis is just the opening, and it's not closing completely because of the way that the muscles have weakened. Yeah, please.
Is that unique to aging voices, or because I have some female singers who have over very recently, or in the last 2 years or so, have had children, and so like the diaphragm and just the whole like muscular hormonal changes, and like what you just described, that airiness, obviously onset and other kinds of things can affect that, but if they try everything and yet it's like they just like physically can't do what they used to do.
So if you've got vocal fold swelling, or edema, which is fluid, which can be really common with hormone fluctuations, then you might get vocal folds that close most of the way. But you've got some swelling over here, and so they won't quite come all the way together.
Do you have to go to a voice specialist to like help do exercises to remedy that, or?
If it's been going on for a while and it's bothering them, then I would suggest going to a voice specialist, an ear, nose, and throat doctor who specializes in singing. Sometimes they call themselves vocologists. You can also just ask singers, who do you go to, and everybody will be, oh, Dr. Sadaloff, or whoever the new guy is in Philly. Maybe it's still.
I'm sorry.
Not at all. No. No, it's a great question. So if it's bothering them, yes. If it's not bothering them and they're just singing as amateurs, I think that, I think they're fine the way they are. And this is this is about the people aspect. But there are also some exercises that we're going to talk about in a little bit that can help with this as well. Yeah.
I was just going to mention the issue that you just described.
Yeah.
I have a church choir, and one of my choir members, she's an older woman, and over the years, her voice has become more and more like that. And she went to see an ENT, and they did all these kinds of different things that didn't work. She ended up having what her daughter jokingly simplified it as Botox injections
Oh,
into
yeah.
her vocal cords,
Yep,
her vocal
absolutely.
folds.
Mhm.
And the way she can sing now,
Yep.
I mean, it's
Yeah.
incredible the difference.
And with
Yeah,
with
absolutely.
Botox- with
It's night and
Botox-
day.
Yeah, with Botox, what they do is they inject it in one of the vocal folds, and it essentially paralyzes it, right? Because you know
Yeah,
that's what
yeah.
Botox does in your forehead or wherever.
Yeah.
Paralyzes it, and then it makes it much, much easier for the other vocal fold to vibrate against it.
Yeah.
If this doesn't move away from the midline ever,
Right.
then it's much easier to get this one over here,
Yeah.
right?
Yeah.
Okay,
I know, it's
so-
wild, yeah.
and we're talking about millimeters, I'm like, whoa, but really, right,
Yeah.
right, yes, so that absolutely is a solution as well.
Yeah,
Yeah, but
I'd
that has
never
to be
heard of that
repeated.
before.
But you can also get filler.
Okay.
You can get permanent filler.
Uh-huh.
Not everybody recommends that, but
Yeah.
that is also a possibility.
Yeah.
But we will get to these exercises when I get to the hopeful part. Okay, let's see. Let's keep going here. Hormonal changes in menopause. Actually, the very next thing I was talking about is that as your hormones change, for people who go through menopause, that vocal fold swelling, that edema can definitely change the way your voice sounds and feels. It can make you feel much more effortful, right? You've also got, I mentioned the cartilages that you've got here, all around here. They start to turn to bone. They start to ossify. Everybody knows what an ossuary is, right? So they start to ossify. They start to turn to bone. Actually, as you age, it's one of the reasons voices get stronger and bigger and able to put up with, or able to withstand more being asked of them, right? It's because they are much more stable as they start to ossify against the pushing and pulling. It's really pretty interesting. But of course, it affects the voice. Changes in facial bones and teeth. You lose your teeth, right? You've got osteoporosis and your bones start to thin. The muscles of the pharynx and the palate also here. As those things change, diction becomes more difficult. Getting a sound that isn't nasal can be more difficult, right? So these are things that happen or potentially happen as people age. There are side effects from medications. There are side effects from health problems, dry mouth, dizziness, etc. We'll talk about those in a little bit. And then of course hearing loss. This is another physical thing that our aging singers may be dealing with. The other thing that I forgot to add was changes in vision. Even just the fact that as I approach 50, I really need better lighting. I need a lot better lighting to read, right? So, alrighty. So then, going along with these physical changes that we talked about, some of this we've already touched on. The typical changes specifically in your singing that you can experience as one ages. Presbyphonia is the official term, and it just means old voice. That's great, isn't it? Right. So loss of range, right? So the changes to all these components of the vocal fold that I was talking about can certainly cause loss in range. Changes in vibrato rate or size, that's a very common thing we start hearing. Either they turn into a bleat or they turn into a giant wobble, right? Development of tremolo is another word for the bleat, right? Loss of breath control related to loss of muscle control, right? Decreased endurance goes along with that. Pitch inaccuracies can also start to happen. People can't sing in tune quite as well as they used to. They may be experiencing some hearing loss. They may just have, as their muscles and as their musculoskeletal system has changed as they age, just maybe aren't quite able to get that coordination right anymore, right? So the way that the voice works feels different. It makes it harder to sing in tune. Breathiness we mentioned, right? A lot of the time, what people will do if they don't like their breathy voice, they'll start to work a little harder to try to get it to not be breathy, and then you get this extra tense sound. I'm actually making my vocal folds close, right? That way I'm not gonna be breathy, right? If you hear that, that might be what you're hearing, but you might also be hearing spasmodic dysphonia, which is it's a muscle spasms that are involuntary. And so if you start to hear that, it might be worth mentioning to the person, especially if they express it as something that's bothering them. See an ENT before, always a good idea not to do too much diagnosing. I mean, we're not doctors. Changes in loudness, right? So they might be a lot softer. They might become a lot louder if they're suddenly working much harder, right? Changes in timbre. You'll hear them become weak or breathy, as we mentioned. Hoarse or strained, as I just mentioned. Changes in pitch of speech as well. Women's voices tend to go lower as they stop producing estrogen. Men's voices, for some reason, tend to go higher, right? So you hear their speaking voices go a little bit higher. They may not have access to the same low well. And then just increased vocal effort in general comes from, again, that body not working the way that it used to, right? If they didn't start out with great technique, this will make these changes will be even more marked if they didn't start out with great technique. But now we're at the good news, great. So some of these physical issues can't be changed, but most of them, the ones that are really the most critical, do have a treatment, and that is exercise. So here we have Robert Sadaloff. He is an otolaryngologist, a vocalist in Philadelphia. He also has a doctorate in vocal performance. And he says here, the bodily changes characteristic of aging are not unique. In many ways, they are identical to those seen in disease and in disuse, such as prolonged bed rest or immobilization of a limb. So I'm going to talk real quickly about this knee surgery I had one time, where they put me in a splint and I didn't bend my leg except in PT for 6 weeks. And I just had to keep shrinking my brace because this muscle not being used wasted away. And then I ended up with one leg this big and that big, and it was just weird, right? But that's what he's talking about here. If you don't use a muscle, it will start to deteriorate. And he says, in particular, muscle disuse causes loss of muscle fibers indistinguishable from that seen with advanced age. Looks exactly the same. My leg looked exactly the same as some grandmother who hadn't walked in several months, right? Exercise avoids or reverses many of these changes in the young, and it appears to have the same effect when the changes are caused by aging. So Dr. Sadaloff and his team talk about what they call a voice lift. And they joke kind of about how, you might know somebody like this. They've had some work done, right? They look great, they look beautiful and young in the hair and the face and all of that. As soon as they open their mouths, they give themselves away, right? So he talks about a voice lift being like a facelift, except it's not surgical at all. His protocol for this voice lift is vocal exercises, medically supervised retraining of respiratory back and abdominal muscles. So retraining all of these muscles of the trunk that are involved with strong breathing and singing. Okay, so this is what he prescribes for people who come to him suffering from presbyphonia. So now the really, really good news is that you can help with some of this stuff as well. Okay, so how can a choral director help? How can you help yourself when you are 70 years old? Well, first of all, if you as a choir director are not familiar with your own singing voice, or you need to learn more about how the voice works, some of you are keyboard players first or other instruments, take voice lessons, go to workshops, read books. I have a resource list that I can email to Peter, he can send to you later if you're interested. Learn more about how the voice works, the most effective kinds of vocal exercises, how to identify vocal problems that you're hearing, and then how you can solve them, right? I mean, I've been doing this forever, so I can hear something and have a good idea of what's going on. If you're just getting started, maybe you don't know these things, but that doesn't mean you can't learn, for sure. Bring in an expert to talk to your entire choir about lifelong singing, right? They probably don't know that their voices don't have to fall apart as they get older. It's just something that you accept. Okay, well, my voice is just not what it was. Okay, it's fine. My mother-in-law, I just don't sing. Well, you should, Mom. You love singing. Well, I just don't like the way I sound. Well, you'll like it even less if you don't sing more. But that's, there's certain things daughters-in-law don't say. That's one of them. But you can bring in an expert to just start to explain the topic just a little bit, right? Don't give your choir the entire summer off. One of the things that I learned and read is that most benefits of training are completely lost after 4 to 8 weeks of inactivity. Okay? Bring your choir back once a month. Have a rehearsal, have a potluck. Try to get them to sing on Sunday, right? Bring them in on Sunday morning, teach them an anthem real quick, right? You can do these things, right? You can have them sing a unison hymn. You can make up or use somebody else's alternate harmonization, and you've got an anthem and they're singing, right? So the more you can encourage them also to keep singing at home, also fun. You can help with general physical issues too. You can encourage and facilitate exercise. Encourage your choir members to meet up together, take walks, or do some exercise, right? They might be lonely anyway. Bring in a physical therapist. As people age, their physical abilities change. Some of them just really cannot do a stand up and stretch. They just can't. But if you can bring in a physical therapist, occupational therapist, they can kind of show people how to modify. They can even show, like if you have specific exercises that you use with your church choir or your community choir, for example. I forgot to mention community choirs have old people in them too. You know, someone can maybe show some exercises that these people can do seated, or show them, you know, okay, you probably only want to go about that far. That's fine. You know, so bring in an expert. You're not an expert in this. Bring in an expert, right? Make sure that you are doing some relaxing and warming up of the body as a part of your warm-ups, and just encourage people as you do it. You know, say you didn't bring in a physical therapist this year. You know, just remind them, only stretch as far as you can go comfortably. I've started saying, let's stand if that feels good. You know, or sit up in a way that feels good to you. You know, that kind of thing, and that gives people a little bit of license to kind of do what they need to do. You really being attentive to the physical needs of your singers during rehearsal is super important. I mentioned lighting, right? Making sure that the lighting is good for folks who have trouble. You might find that they're having trouble reading the words because they're too small. They just need better light, and they're going fit over there, and you're screaming at them about diction. Nobody screams at anybody, I know. But you're upset about their diction on the inside where no one can see it. Maybe they just can't read the words, honest to goodness. Some people can't sit or can't stand for very long, so making sure that people know when you're ready to sit down, please sit down. Please let me know if you want to stand up. I always forget, because I'm standing for an entire rehearsal, I forget to stand people up. Please ask me if you want to stand, right? If people are having trouble holding their music, just get them a music stand. It's not that hard, but we don't always think of these things, right? You know, because none of us are in our 70s now, right? If you are, you look great. Sometimes the chairs that you might have are like the ones that they took out of the when they redid the fellowship hall, right? So they're really terrible. Get wedge cushions, like a 15 to 20 degree wedge cushion. Offer them to people, or suggest that people get their own, or some of them have them at home. Hey, maybe do you have a wedge cushion? Bring it in if that makes you feel better. Easy conversations, right? Encourage your singers to talk to their doctors about health problems that are affecting their singing. They might have allergies, they might have GERD, gastroesophageal reflux disease, very serious for singers, because that acid can get up there and really kind of inflame things. Even if you don't have heartburn, you can have GERD, right? I don't know how that works, but it does. And it affects a lot of singers because you're constantly moving. You know, you're moving your stomach and the rest of your guts up and down, right? Things are splashing, you know, as you get older. I mean, they are, aren't they? You ever finish singing and you're like, ugh, right? A lot of people don't like to eat before they sing because of all of that. It makes you feel sick, right? As you get older, maybe that gastroesophageal sphincter doesn't close all the way anymore. A lot of people do get GERD, right? So make sure that they know this can affect your singing and talk to your doctor. Neurological disorders such as Parkinson's disease can affect, if you've got a tremor, can make things more difficult. Asthma treatments also, that's fun. Hypothyroidism, very, very common as people age, and that can affect your singing as well. Medicine side effects. As we get older, we get on more medications. They might be dry mouth or tremor, or you know, and there are lots of different medications in in many of the classes that older people take, blood pressure meds and you know that sort of thing. There are lots of different meds they could try if they just haven't felt right since they started such and such, you know. Issues of the vocal mechanism. We talked about just general physical stuff. Encouraging singers to investigate voice lessons or vocal therapy. They might not believe that their voices can improve, but they can. They really can. So encourage them, right? You can teach them some at-home vocalizing exercises that will help rebuild some of their strength. There's a whole set of them here that I thought we would try. And I'll tell you about this study. What they did for this study, there's this whole list of exercises here. And what they asked people to do was, most of them they did for 4 minutes, you know, just resting and breathing as needed, but they would do them for 4 minutes and then move on to the next one for 4 minutes and so on. And they were assigned to either do these 2 times a week or 4 times a week. So, tongue or lip trills, right, with continuous phonation, so, or some people can't do that, so the tongue trill is an option, right? Just for as long as you can, and then take a breath, and then do it again, take a breath, do it again, 4 minutes. That's not very long. I mean, it is, actually, they're gonna feel it, right? They will feel it, right? And not just in their face, but the breathing muscles that are required to sustain that phonation, right? But that's a really good exercise. Nasal sounds are next, and that's again, either continuously, right? Or you can do, Okay, let's do a couple of continuous ones. We'll just do those for a few minutes, and not a few minutes, 45 seconds, say, and just take a breath when you need to. Let's do the either lip buzz or tongue trill. Here we go. Just take a breath when you need to. The shorter, you know, so maybe like, here we go. Right? So every time they start that M, they are bringing the vocal folds together at the midline and trying to get them to vibrate together well. So this is actually an exercise in initiating sound, which is going to help with recognition, right? Vocal glides, so do a couple of those. Right, you can do that also with the lip buzz. You can do it with nasal consonants, or ng, try that one. Right, and so you can just go from bottom to top to bottom, however you want to do it. Zzz is another good one. 4 minutes. Okay? They're gonna want to start with 2. Right? This is like a study. They were serious about this. But anyway, we know that this works though, and I'm going to talk about that in just a second. So maximum phonation time, that's when you try to do a sustained vowel louder than normal. For as long as you can. Right? Try that. Right, and you can do that much longer, I'm quite sure. I don't want to go into a maximum phonation contest with the best group of singers. I heard you all sing yesterday. I'm not going to win. But really, one of the things that's important is that you don't want to do the effort. Should not feel too effortful, right? Not excessive effort. And you want to control the vocal quality all the way through, and that's in the notes there. You don't want it to turn into right? Right, so they want to do that as well as they can. When they can't do it well anymore, it's time to stop and take a rest, right? And then we have these semi-occluded vocal tract exercises, okay? This is usually just phonating through a straw, right? Right? But you can also semi-occlude your vocal tract with semi-closed, isn't it? But in this particular study, they gave you a straw, and then you voice bubbles into either 1 to 2 centimeters of water, and then 10 centimeters of water. That's a lot. That's much more effortful to move water like that. So they had both of those as a part of this. We have neither straws nor water, but you get the idea, right? Either sustained or short. Right? You can do little short ones like I used to do in my milk as a kid, right? Right. So, the details of this, whether you do it for 4 minutes or 2 minutes, it's all in the appendix. But what happened was that, I mentioned there was a group who did them twice a week and a group who did them 4 times a week. So both groups, at the end of the study period, felt that their vocal quality had improved. And actually, it sounded like it had improved as well. They also felt quality of life was improved. Because why wouldn't it? If you're a singer and you can sing better, or if you're just a speaker and you can speak better on the phone, talking to people, and you don't get misgendered anymore or whatever, right? That's a pretty great quality of life issue right there. And 1 month later, so they stopped doing the exercises. A month later, still in pretty good shape. That's pretty cool, isn't it? Of course, we don't want our singers to stop doing that. The people who did it intensively 4 times a week, they also actually reduced that vocal fold bowing that we talked about, where the vocal folds wouldn't close all the way, right? So that's a really big and important improvement. They're able to keep going with that. That's really great. Ingo Tietze, who's another vocalist, he has a set of exercises that he uses with straws. They're on the back page, the very last page. He describes them there, sirens, hills, accents, melodies. But I've also put a YouTube link in so you can watch them. That's something you can actually share with your singers. They're pretty cool. There's another technique called, it looks to me like lax vox, but I don't know how they say it. They say, actually I'm a choral conductor, it looks like lax vox. And they probably call it lax vox, I don't know. But anyway, there's a link there. They actually will sell you a tube in the right length to do their exercises. So they'll say anything. So I gave this talk to a choir. I was invited to go talk to a choir about this and explain these exercises and all the other stuff that I had just explained to you. And I got a thank you note later, and they said, we can't wait to try all those straw exercises. I'm like, how about you take a walk? Right? How about you lift some weights? Come on, people, it's not just this thing, it's all of this, right? But this is a really helpful thing that can get people feeling better about their voices in as little as a month's time. So then hearing loss, this is something we all deal with, a couple things that I learned from one of my voice students, actually, 72 years old. And she would sing something and she would cut off, and I would say, all right, could we go back to, and then she would say, what? And I didn't realize that, I finally realized, that she was having trouble because there was still some sound echoing in the room. And if I waited for that to clear, then I could say, let's go back to page 2, and she'd go, okay. And it's like, I had to wait, but it's no more time than I took repeating myself, right? So if you think about it, and the other thing that I sometimes have to deal with is like someone who's hard of hearing will ask a question and then 4 people try to answer it all at the same time, and they're all talking. That's not gonna help, right? So usually I get kind of, one person answers that question, please, and everybody's like, oh. But that's one thing that really annoys me at school and with other players. Speak with your head up. If you're the keyboardist for your group, that's a real issue, right? So you're playing, we just had a break, All right, so what I like to do is go back to page 4, right? And if you've got people in your choir who rely on being able to lip read as well as hear, they just missed everything you said, right? Again, going back to my sainted mother-in-law, I love her dearly, I really do. But she has wonderful hearing aids, but also needs to see lips, because if she misses a consonant, she can't tell if I just said time or fine, right? So she needs to see my face. And so speak with your head up, right? This is something that I've read and not tried, but I'm putting it in here because someone swore by it, that you can work one-on-one with singers who have some hearing loss and just really try, if you can sing a pitch and they can sing it back, or you can kind of help them move to it, they may be able to feel a resonance when they're matching your pitch very, very well. None of us are paid enough for this. But I put it here as a potential solution, okay? So now let's talk about these emotional, intellectual, and social experiences, because again, we're talking about people. We are. And certain things happen as you get older. Your friends get sick, you lose loved ones, you might have to move from the home that you raised your children in to a 1-floor apartment somewhere, right? And so there's loss and grief, for sure. And if you've always loved singing and your singing isn't working the way it used to, that's another really huge loss, right? So that's something that our people are dealing with. Anxiety and frustration, also very common. I used to be able to do this, I can't do it anymore, and this is really frustrating. I may be actually anxious about whether my retirement's gonna run out, or whether, my son is ever gonna figure out what's going on with his, whatever. Right? So there may be that kind of anxiety, but there's also, that sort of generalized anxiety that actually is a mental disorder, right? A mental illness. Cognitive changes, very common, right? Including memory changes. There are 3 kinds of memory problems here. Acquisition is one of them. So that's actually getting the information into your memory. Retention, holding onto it, is another. And then also being able to retrieve it or call it back. So it takes longer to encode things into memory as you age. So you may have taught that soprano part 7 times. You might need to teach it 2 more, right? Because it's taking that long to get it into memory. But once it's successfully learned, it is preserved, okay? And they can be retrieved. So declines occur in memory retrieval. So that's part of an issue as well. So I think you just have to accept, if you've got a choir full of older people, you might have to do the soprano part 9 times. What that means is you might have to start that piece in March, whereas if you had a choir full of 20-year-olds, you could start it in April to sing it on a Sunday in May, right? And if you can keep those things in mind, you eliminate frustration for everybody, right? Increased isolation and loneliness, of course. Mood disorders such as depression, I already mentioned anxiety. Older adults are at increased risk of depression. It's more common in people who have other illnesses like heart disease or cancer, right? And we know that older people have at least one chronic condition, sometimes more, two or more chronic conditions. And so that puts them automatically at increased risk for depression. Older adults are often misdiagnosed, undertreated. Okay, so you healthcare providers may say, well, you know, I know you're sad, but you're sick, or you're sad, but you just lost your friend, right? But you know, if you have depression, you know that it's more than that. It's more than sadness, and it's something that extends for a long period of time and doesn't seem to resolve the same way that grief kind of goes through its cycles, right? But you know, it's very common for healthcare providers not to take that quite as serious as they should in older people. It's just a natural reaction, maybe. Older adults themselves sometimes share this belief. I don't think my dad would ever talk about his anxiety ever, right? Like, Dad, you have anxiety. Like, so he doesn't, right? Right? And I mean, thinking about like my grandparents' generation, whoa, no, nobody talked about this stuff. Nobody talked about this stuff, right? I feel so great that we actually do now, right? There was a great meme a few years ago where like it was boomers saying, I heard so and so was in therapy, and then millennials are like, guess what my therapist told me?
Yeah.
Right? So anyway, but I'm glad we're there, you know. So some estimates, major depression in older people living in community with friends or in a home where in like a retirement home where they're active and are with other people, estimates of depression maybe range from 1 to 5%, lower than the general population if they're in community. But if they're isolated, it could be 11.5%, they said, in older hospital patients. If they require home health care, which makes people extremely isolated, 13.5% of these people are depressed by one study's reckoning. That's very serious, right? The good news is that there are things, again, that you as choir directors can do. Done with the bad news, on to the good news. Remove the stigma of mental illness, of mental disorders, right? Just talk about it, just do, right? I think it's really important. I do that with my own students, because I think that's really important for these young folks, even more so for people who are older than me. Keep an open dialogue, know the symptoms of depression, anxiety. You may know your people better than anybody else in their life, who knows, right? And so if you see something that looks different, you know, you might talk to them a little bit, encourage them to talk to their doctor once again, right? I have a couple of links here with symptoms of depression that you can read about and anxiety that you can read about. You can also encourage your folks if they're observing cognitive changes to talk to their doctors as well. Okay, that's really important. People are just like, well, I'm old now. This is how it is. Not necessarily, right? And of course, there's a difference between not knowing where your keys are and discovering that you put them in your refrigerator, right? And it's a real relief sometimes to older people to realize, I don't currently have dementia. I just have like normal age-related, I probably should hang my keys on a hook in the same place every day, kind of thing. I should make more lists, right? It can be a huge relief to people to talk to their doctors and get that sense that they're actually gonna be okay. Encouraging your singers to continue to come to choir rehearsals can make a big difference for their emotional and spiritual lives. I had a gentleman in my church choir in St. Louis whose voice had gotten quite wobbly. He was a singer in the Ambassadors of Harmony, which is this massive, you know them, right? Yeah, oh, you sure do. This massive barbershop choir, 180 or so singers in St. Louis, award-winning everywhere. They just destroy wherever they go. They're amazing. And he had sung in that group for years, and their director finally took him aside and said, Don, you have too much vibrato now. your vibrato's gotten too big and we can't have you singing with us anymore, I'm really sorry. And I have no idea what that experience was like for him. He didn't tell me and I didn't ask him. That happened before I got to know him. It was probably very upsetting. You can imagine what that would be like. But they encouraged him to keep coming to rehearsals. He comes to rehearsals, he goes on tour, he goes to all of their concerts. When he talks about them, he still says we.
That's awesome.
It's incredible. It's amazing. And he may be a particularly resilient person, right? But even so, I think if you have to transition this person to a new section, if you have to transition them to a new role, the brownie baker, the librarian, the note writer, whatever. If you can transition them to a role that allows them to still be involved, have them come and listen. They can sit out in the house and tell you how the balance is. Whatever. You don't have to do anything with that information, So I think that's really important, that you encourage people to keep coming. Do not be afraid of hard conversations. That's a whole other workshop that someone besides me should be leading for sure, right? But they're important. It's important to they know, some of them know already and are just waiting for you to tell them, right? Make it clear that it's okay to make mistakes, okay? I know how hard it is not to tighten your lip, right? You ever catch yourself doing that? Right. All right, let's go back to page 5. Right? I just communicated a lot of stuff right then, didn't I?
Trauma.
Right. Exactly. That's exactly what I just said. So people make mistakes. You just, my voice teacher used to say, it's the first pancake. You throw that one away, let's do it again. Right? And that was I love that. That made me feel a lot better. Because sometimes the first time you try something, it's bad. Right? Yeah, first pancake. You throw that one away. Yeah.
You still put it with the rest.
I know, right? Yeah, I mean, you eat it while you're standing there.
Yeah, exactly.
That's how you do that one, right? Exactly. And just to laugh, or if you make a mistake, laugh about it. Whoops. This is what I say a lot. Let me do that one again with F sharps.
Yeah.
And then we go back, and it's funny, and everyone's like, she messed up. All right, that's fine, she makes mistakes. Have lots of pencils available. Use yours a lot. Every time you say, all right, let's put this cutoff on B4. You wanted it on 4 anyway, you knew that, you didn't even bother to write it down, because you knew, there was no question, that one goes on 4. Can we put that rest on B4? Write it down, right? You're modeling to them what it is to be okay with not remembering this next time. Or what it is to be okay with the fact that I just made a mistake with this, and I'm just gonna mark it so I may not do it again. So being a model, also having pencils available. And I can't tell you how many times I've gotten to a rehearsal and thought I had a pencil. I had one all day. Now I don't have one, right? Respect and appreciate the efforts of everyone in the choir, right? Don't let anybody else disrespect what they're doing either. Nip it in the bud if it happens right in front of you, right? If you can, in front of everybody, say that is unacceptable, right? If someone says, well, if John would, or if someone goes, say, that's not okay. Because everyone will see you do that. And maybe John is, not with the group at the moment, and he won't see it, but everyone else will. And that makes a really strong statement about where you stand in respecting the whole group. That's really, really important. Praise them for small successes. Love the way you all put the T on 3 like we've been talking about. That was so good. I just want to commend the tenors for that beautiful vowel. That's all. I don't have to say they're great. I just have to say they had a good vowel right there, right? And you laugh, but it's really.
You gotta find
real, right? You don't have to lie. You don't have to lie to make them feel better about what they're doing. Find the small thing, right? You've got to know what small thing you're looking for, which is what I'm going to talk about in a minute. But going on. Be quick to offer solutions to solve problems. This is a score study issue and a rehearsal planning issue, right? When you're studying your scores, and I know that a lot of choral music that you sing in a church may not need a whole lot of score study, right? Some of it's quite simple. Some of us fall into the trap occasionally of learning a piece along with our choir. If we just had a tough week and it's like this one, I can play the piano part. This mostly in unison, and then, oh, I see what this melody, I see what this harmony is doing, so it's gonna be fine tonight, you know? But that little bit, whatever time you have to spend in score study can say, you know what, I already know they're gonna have trouble with this text in these 8 notes, you know, or something like that. And then you're thinking about a solution as you prepare for that rehearsal. So your score study, your rehearsal prep is where this stuff comes down, right? Having solutions to the problems that they have. It's gonna make them feel a lot better when they make a mistake. If you can say, oh, you know what, let's try it this way. Can we do it without the text, or whatever your solution happens to be. My choir doesn't, or my last church choir didn't like doing things without text because it helped them keep their place in the music. And I realized that, and then I stopped asking them to do it that way, because it was just gonna frustrate them, you know. So when you get to know your people, sometimes you make choices like that. If you decide to repeat a passage in rehearsal, and I hope I'm not telling you something that you don't know, right? If you decide to repeat a passage in rehearsal with really specific instructions, right? Why are you going back? Why do you wanna do that again, right? Because your singers need to know what to focus on, right? How will they know if they accomplished something if you didn't tell them what they were supposed to do, right? So they need to know what they should be trying to do. It's also important so that you have something to praise. I wanna go back and do pages 4 and 5 again. All I want us to focus on is final consonants. So we do pages 4 and 5 again. All they focus on are the final consonants. They were brilliant. And then I can say you were brilliant, right? If I just say, can we do pages 4 and 5 again? Why? Were we bad? What did we do? You know, I've sung in choirs like that, and that's not cool, right? Sometimes I will say, I want to do pages 4 and 5 one more time because I need to hear it better. So I can offer some suggestions. Happens sometimes, right? We're not all knowing.
We're all super.
We're not. You're absolutely right about that. So that's really, really important. It's how they know whether they've accomplished something or not. So you have to have some ideas, and you have to have enough ideas in your back pocket before you get in there, so that you know what you have some ideas, right? It's also not fun if you come into a rehearsal and they don't know what to work on. They're just like, okay, that was good. All right, let's move on to the next piece, right? Sometimes you can hear things, but sometimes you know ahead of time, I bet you they're gonna have trouble with this. I may not be able to hear it until I take it apart, right? So these things kind of happen. That's the kind of thing that, you know, having done this for 30 years, I'm like, okay, this is easy for me to figure out. If you're brand new to it, or you've only been doing it for 5 or 10 years, you're not gonna see all this stuff right away. It's definitely something that happens with experience, but you have to try, right? You gotta try, and trying is where the learning happens. You know, trying and failing is information, right? That's something that I try to convey to people too, who are tending to get frustrated. Is like, you know, every mistake is a piece of information you can use. Princeton students especially, they're just so afraid of making mistakes. Like, that's not a mistake, that's information, come on. When you work in rehearsals, working methodically, dividing and conquering, you know, I mentioned text and music, taking them apart. If that doesn't work in your group, then fine. You know, maybe they can do text in rhythm without notes. They can't sing the notes without the words, because they get lost. Then do the text in rhythm first a bunch of times until that part has become second nature, and then put it back to the notes and see, right? But you might be able to separate rhythm and pitches. Let's just do the pitches as quarter notes, right? Or let's pick a single chord. If you're singing in Latin, let's pick a single chord and let's just sing the text on this one chord, right? You know, there's a lot of different choices that you can do, dividing and conquering, so that you're not trying to do too much at once. Because again, as your cognitive skills decline and your ability to encode information kind of slows down a little bit, doing too much at once is really kind of frustrating, right? You don't even perceive exactly what's happening. So taking it apart is a useful thing. Give ample time to learn new music. I alluded to that already. If your folks take more time, then you gotta give them more time. That's, you know, if you don't have the right to get mad at them. Yeah.
I go back and forth, and I completely understand that in volunteer choirs, the probability that any one particular person is going to practice outside of the rehearsal is 99% no, 1% yes, except for that one really eager, like a 22-year-old.
Right.
But if you set a precedence even with an ensemble with median ages between mid-20s, late 30s, 40s, with a couple of olders, like what is a, could you have that expectation of not necessarily making practice recordings and learning and practicing the music in rehearsal, but having that expectation, or
Having the expectation
to practice at home and have methodologies for practicing, or?
I think if you don't want to be in the habit of making rehearsal tapes for people to practice at home, tapes. Making rehearsal recordings for people to practice at home, you can still encourage them to practice speaking the text in rhythm, which they may be able to recall. I think that's one thing that they can do is practice text in rhythm, big time helpful. Clapping through the rhythms, even just looking through it at home and going, oh, we put that diminuendo in there, that's right. I'm just gonna speak this text with the dynamics, Those are things that they can do without having to own a piano or know how to plunk out things or be able to hear their part without someone right next to them singing it. So those are things that they can do. Depending on what music you're buying and using, there may be rehearsal tracks available. And if I'm not shy about using them. If they're there, hey, and if you have the budget money to buy them, go for it. Go for it. I know that what we would like to be doing with our church choirs is what we would like to be doing with our school choirs, which is to be teaching them to read, making them independent musicians. Absolutely, 100%. The challenge there, I think, for a church choir is that you are singing every week. You might be singing 2 or 3 different things. You might be singing 2 anthems plus an entire communion, right? And in situations like that, expecting melodic independence on top of rhythmic independence on top of, it's a lot to ask when you're churning through music that quickly. I find that even with chapel choir, because we sing 3 things every Sunday, and we're also gearing up for an end of semester concert every semester, right? So sometimes I'm just like, here are some recording track, here's some rehearsal tracks for this Bach cantata that's on our April concert. If you can spend some time with that, that'll save us a lot of time. Yeah.
Just along with that, whenever tracks aren't available and I don't have time to make them or anything, I've found just giving just a recording of the piece at all and saying, you don't even have to look at the music. Play it while you're driving, play it while you're washing dishes, but get the piece in your head. Every time I do that, a new person comes up, oh yeah, okay, that actually helped. I know how the piece goes now. And it's so much easier to then learn their part in rehearsal, even if they're not looking at it between rehearsals or what. Just get the piece in your body a little bit, and then everything else comes much easier after that. So whenever there aren't tracks available, that's a good, baseline.
Yeah, that is a really fantastic idea. Because unless you went to music school, and maybe even if you did, your sight reading is educated guessing, right? And so, unless you went to music school or you had choir directors over the years who built up this skill over a long period of time. Sight reading is easy when you start when you're this big. Super easy, right? When you're learning how to do everything else. People are like, how do you play and sing at the same time? Well, I did it when I was 7. I didn't know anything was difficult, or everything was difficult, so why not?
Yeah.
Because many of them are reading, making a guess about that leap. Reading, making a guess, right? If you've given them a chance to get the overall maybe harmonic content or maybe some of the melodic stuff in their ears, then those guesses get more and more educated. So absolutely, I think it's a fabulous idea.
Do you have any experiences or suggestions with? I've been in situations sometimes where I know one person in my choir is dyslexic, and sometimes with children, I'm suspicious that a few of them might be, especially if it's they might have ADD in addition to, or they can't focus on this, so they're just distracted, right?
Yep.
And it might be just because they have dyslexia, but I don't know that, and maybe their parent doesn't either. But I don't know if you have any strategies or whether with children or adults, or I don't know, because
That's a really, really good question, and I would say, with children, it can, you know, a quick, you know, pull aside with the parent at some point can be really just a quick conversation. You know, I just noticed, I'm wondering if, you know, I'm way overstepping because I am just a choir director and not a, you know, I'm not a doctor, but I wonder if, right? And I think you can potentially have those wondering questions with adults too, you know. I just noticed that you seem to be having a little bit of trouble with this text here, and I wondered if you'd ever considered, or, you know, and if they come back with, no, I never have, or then you go, oh, okay.
Yeah, well, because especially if people have like attention issues for
Yeah.
something, and you're like, you're trying to understand and figure out
Right.
how to respond most appropriately.
Right.
And it's a kind of, if it's not clear, it's a educated guessing game
Right.
of how to help them, you know?
Right,
Or-
yeah. I have there's someone in my choir here at Princeton that I'm absolutely positive, has an attention deficit or, you know, kind of executive function thing happening. I'm not gonna ask. It's not my business. And there are certain sort of lines at a university that like you don't cross, and so, you know. But what I did was I went to Staples and this summer, and on sale I bought a bunch of modeling clay with crunchy stuff in it. I'm just gonna put that out on the table and go, if anybody needs like some sensory stuff while we're working, help yourself. You know, spinners, fidget spinners, you know, you can have them for grown-ups too. My husband loves his fidget spinner. I don't know what he's doing, but he's just, you know, all the time fidgeting with it. I mean, he's fidgeting with it, that's what he's doing. That's what he's doing. But, you know, so you might have those things around, just as a, you know, I'm just gonna put a big sign and be like, hey, sensory folks, here's some toys. Because my kids love toys, you know. I knew a guy who was a software engineer, and at meetings they put little, you know, bendy animals on the table, and they would sit there and play with bendy animals while they were talking about software, because it sort of, you know, helps loosen the creativity. So you can put those things out there as just the next one, you know, and say, hey, these are, you know, if you ever get bored during rehearsal, here's something to play with, you know. I don't know. I mean, I'll get back to you and let you know if it does any good. But, you know, I can see some of my students that are kind of, you know, they just checked out, and I know I'm boring, but they just checked out, and I really need them to come back. And I actually learned this from a former pastor of mine that I worked with, who's a friend still. We had a Zoom call, and just to catch up with each other, and after about 30 minutes, she just reached over and started playing with Play-Doh. I was like, what do you? And she's like, I live in England now, and can't get my ADHD meds. Oh, that's bad. But anyway, but she had found a thing that worked for her, so I was like, oh, I can try that too. But you do have to walk a line because it's medical stuff.
Yeah.
Right. So involving parents, a wondering question, not a, have you ever talked to your doctor about? Which I feel like if you're if they're obviously like, I mean, I feel like depression, anxiety, intervene, right? You know, physical problems that maybe they're not thinking about, intervene. Like that stuff is harder for sure, I admit. Yeah.
So it's kind of along that line.
Yes.
The mom, of course, there are children situation, flaming flaming. It's a public knowledge, mom acknowledges it, but there's absolutely nothing done about that. But still comes to the choir. But to this day, this is 4th year, she's never brought a binder. She never knows where things are. Like, she cannot match pitch. But
She's there, and sometimes, I mean, and when the clergy,
But she's there.
and when the clergy that you work for are looking for butts in seats, sometimes that's a very difficult kind of, you know, thing too. Yeah, that's really a challenge,
It
isn't it?
is. I'm like best friends with the mom.
Yeah.
And I talk to her, and I'm like, yeah, oh yeah. I mean, we all know she's like flaming PhD, right?
Right.
It's just like her. She's just like this. And then, but she teaches and seminary.
I came out fine. No one did anything for me. Yeah, right. Yeah, you know, I think that conduct, you know, standards of conduct are useful to have, right? And to just, you know, just to be able to say, you know, your child, we have these standards of conduct where they need to be able to listen. I promise not to talk for more than 2 minutes at a time, but they need to be able to sit and listen, or, you know, they need to have their binder, and we're working with a point system here, and we have to do this because it's not fair to the other singers, you know. Is it
Just going back to page 5
Yeah, absolutely.
where we ended, this whole, closing reflections mark.
Oh, yeah. Shall I talk about that? I'll move, thank you for moving me on. All right, very good. All right. Nicole, you're clearly fixating on this thing. Speaking of, no. Okay, so we talked a little bit about recordings to practice with. So closing reflections, I stole this from Michael Kemp, who, like his mother Helen, has done marvelous work with volunteer children's choirs, right? So 3x5 cards. In the final minutes of rehearsal, you can ask your singers to recap what you've worked on today. And they might be able to tell you, oh, was that diminuendo on page 5? We were really working on our final consonants, right? Ask people to write these things down. Discuss them as they come up, because this is an opportunity for you to find out that they totally misunderstood what you meant, right? That has happened to me before.
Yes.
One of my voice students accidentally left her journal, her lesson journal in my studio, and I opened it up to see whose it was, and I was like, I did not say that. That's the opposite of what I said. So this can be useful to get people kind of talking and remembering together about what you've talked about, right? So you can correct mistakes potentially, ask them to write them down, and then what they do is they take home that card and they read it during the week. If they take home their music with them, that's really useful because they can like look at what it says on the card and look at it in the music, right? That's a really useful thing. And then ask them to, when they come into rehearsal, to reread the card one more time. You can even take a minute, while we're sitting down and stretching our legs, how about you take out your card and while you're rolling your shoulders, or whatever, so that you're working with this recall, which is right, that memory recall thing, so that you're making them do it again and again and again. It's kind of like that where they're practicing that initiation of sound, practicing that recall of this information you want them to know again and again and again. Yeah.
I think that tip, now that I'm thinking about it, is exceptionally good when you are teaching pedagogy across a semester to volunteers.
Yeah.
Because then you with individual cards, you build like a stack of like note card pedagogy.
Oh, that's nice. Yeah.
Like over time, and so it's like, yeah.
Yeah, that's very cool. That's very cool, and that will work. That can work well in the classroom as well. Yeah.
Yes, I normally ask at the Sunday before math rehearsal, please recollect your memory from the rehearsal. And I'm the youngest, and all of my choir members are older, 55 plus up to 80. Yeah, so this will definitely help.
Yeah.
But even at the end of the rehearsal, I don't know if they could go back that far.
Right.
So it would be okay to do like every song.
Yeah. Yeah, I think
that
you
might
could.
be better for them.
Oh, that's a very good idea. Right. While things are still in kind of short-term
Yes.
memory, it hasn't been encoded in
Before
long-term
we
yet.
move on to the next.
Yeah, absolutely. If you do have people who are developing kind of early dementia, especially that short-term memory is one of the first things, besides the keys in the fridge. That's me whistling past the graveyard because all the women in my family have died of it. So I'm kind of like, all right, so it's gonna be my turn soon. Anyway, yeah, absolutely. If after every piece you say, all right, what are we putting on our 3x5 card for this piece, right? Yeah.
I had a friend who used a similar system, but they had the same concern about waiting till the end of rehearsal. So what they actually did is they got a ton of those tiny little Post-it notes and gave them to everybody in the choir. And any time during a piece, at the end of a piece or anything, write something about this piece. Cut off on this or whatever. Write it on there and keep that. And then she had up in her choir room a poster board for every anthem or song or whatever, and they put those little stickies for that thing on there. And so as you come in, you could look, oh yeah, these are all the things we've talked about over these past 4 weeks that people have noticed for this one song or something.
That's really cool.
So it's just kind of an offshoot of that same principle.
That's really great. I love that. It can help too, practicing recall from your memory, even if you don't actually get to the memory, is useful, right? So, when in Princeton's chapel choir, when we pick up a piece of music, I'll say, who remembers who can tell us something that you remember we talked about? I have to ask for hands, because I want everyone to try to think of something in that silence. Even if they can't think of of something, the act of trying kind of primes the brain to learn better. So that can be a useful thing as well. It sort of encourages them to at least try to recall, you know. Other thoughts about that? Ideas? Untested? Yes?
Well, this is going way back to dyslexia. I just know a friend of mine had dyslexia, and I think, and she would just take the music and isolate her parts, and that helped, just keep it focused. She would look at a page and just, it was too much.
Right.
So just, you know, covering up the other
Yeah.
parts was something that she found helpful.
Oh, that's really great.
That's easy to do on an iPad with like Foursquare or something.
Yeah.
You can, I do that all the time when, I don't have dyslexia, but even just when I have, 8, 10 parts or something, and I'm going page to page instead of circling my line or something, I'll go like, with some transparency, blur out all the other lines, so
Yeah.
I can still see them if I need to,
Right.
but my line is the only one that is very clear to
Right,
me.
it's like even better than highlighting.
Yeah,
It's not
yeah,
so, it's that, the
exactly, yeah.
highlight would be too.
Right, yeah,
Yeah,
yeah.
right. And there are a couple of fonts that have been designed to be easier
Yeah.
to read if you have dyslexia. So if you have, if you can, like if you've got Adobe Pro, you can scan the thing and and go in the PDF and actually change, you can rewrite the text, you can change the font of the text, it somehow finds text and then lets you change it. Right, it's the expensive version of Adobe
Yeah.
that school has.
Yeah.
But if this is something that would be useful, or if you find yourself needing to make large print versions of things, right? That could be a useful investment for your choral program, for your church, for your school, for your community choir. So be sure that images and references you use in rehearsal are relatable, okay? I think if you start talking about artists that they've never heard of, it just kind of sort of reminds them that they're old, right? And, I try not to just because I don't want to be embarrassed in my classroom, like, so yeah, I know this part kind of sounds like Britney Spears, who? But just something to think about, and then actually, even if you can make a little bit, I know she is. She's free though. If you make an effort to try to learn, something something, if you have, enough people in a particular generation that you can go watch one of their TV shows. I mean, I can't tell you what happens when I talk about how much my husband loves, well, they don't like it when I can't remember. The Andy Griffith Show.
Oh.
Yeah, see what you did? You're not even 80. Great. Great. So, sometimes things like that can just kind of create a warm sense of community, when you say something that, and then they're the ones who know something. And that 22-year-old college kid, yeah, she can go home and play her part on the piano, but she doesn't know about the Andy Griffith Show. So these little things. And then as I mentioned before, thinking about the emotional and spiritual and social feelings of the people in your group, convey respect always. Always. Just really practice your poker face. Let them know all the time how much you appreciate them. If you can't appreciate their high F, then appreciate appreciate their leadership in this rhythmic passage, or thank them for always wearing their stole properly or something, right? Again, you don't have to lie. You really don't have to lie. Practicing gratitude is something that's really big now. I mean, it should be big. It should always be big. But it is, when you're practicing your personal gratitude, it's like looking for little things that you can be grateful for. So same thing with your choir. The more you can find something to love about every single singer, even the ones that are not even the least bit lovable, the better you will be, right? And if you have to pray to God to help you find that thing about Edna, what can I love about her? Also look, my thing too about whether sometimes if you're younger working with older folks, sometimes they can trigger in you a sense of being, worthless or stupid, or whatever, because sometimes they will treat you. I had a couple of people. My first church job out of my master's degree, so I'm 23 years old, and a lady said, she was disagreeing with me on something, and she said, "Well, I've been singing in this choir since before you were born." And I got in the car to go home, and I cried. And I was sad for days from that, because I felt really worthless with that little, I just like, I don't belong here, they don't respect me, I don't know anything, who the heck do I think I am? You know, it really threw me for a loop, right? So sometimes, you know, when, I don't even remember where I was going with this, but I think that, you know, sometimes when we get upset with an older person in the choir, it can be useful to think about what's happening to me, you know, what is this triggering in me, or what is this awakening in me, or reminding me of, or making me feel, right? It's just worth a thought anyway. Peter?
This is, I guess, I'm just thinking in oftentimes with dealing with older choir members, what you have to tell them in terms of correcting them is often the same things week after week, or like similar things that they, you know, always do, and they know it's their thing. So I don't know, just if you have any strategies for that, because I mean, obviously you have to, you want to maintain the standards, and
Yep.
yeah, change is hard, especially when you're older.
Yep. Yeah. I guess the question to think about is, you know, which standards are the most important ones in the moment. And it might be that the standard of making this person feel warm and loved is important. It might be that the standard right now is to just keep moving because everyone else is getting, you can see the frustration on the other folks in the group, or just, it's time to stop going over this. And you might just say, you know, how about you and I work on this outside? Why don't you stick around? If you have 5 minutes after rehearsal, let's work on that then. So that you're moving on, and that's a, you know, so the question then is, what's the principle to uphold this moment?
Yeah.
And that's reading the room. That's, you know, if you're in a church situation, it could be sort of kind of, you know, seeing how the spirit is moving. If, you know, however you personally think of it, if it's just reading a room, right? You know, so that you can decide in the moment what's the best thing. And I think that the making the choice to not show any frustration and to not say, we've already done this enough times, let's do it outside of rehearsal, right? I really think word choice matters. I have found in my life that when I feel like I just took a whole 3 minutes to think about what to do next, it's been a split second. You know, when you take those moments to just kind of think, and it feels like a whole lot of time just went by. It didn't, you know, so you can take the time to decide, how do I want to respond, what's most important, speak, you know. So that's another thing, it's just that self-control, self-management that's important too. Yeah?
And along the same topic of appreciation and finding the things to be grateful for,
Yeah.
I had a colleague who's now retired who, back when I was first getting into directing, I asked them, because I happened to know personally that they were just generally not a very nice person in rehearsals, and yet their choir was massive and always growing and the most loyal. I mean, every person in there would, you know, do anything for that person. And so I, in my most diplomatic way possible, I asked, you know, how do you do this? How have you gotten this? You know, what's your secret? Yeah, you know. And they said if I had to pick one thing that has been my secret weapon over all of my years of doing this, is that every single Monday morning when I get into the office, the very first thing I do before I write an email or anything is I write a handwritten thank you note and I mail it to one person in the choir. I just go alphabetical. Every single person gets at least one letter or one note every single year, and it means so much to them. It takes 5 minutes of my time, and you have no idea the kind of trust that you can build with something like that. And I have to just thank you so much for your involvement. We love having your voice in our choir family. That's, you know, that's all you got to say. And you can say the same thing to every person if you want. You know, it honestly doesn't matter. It's that act of you were thinking of them in that moment, and doing something something as meaningful as writing something down and mailing it to them means something real. And I try and do that whenever possible, but they said if I had to pick one thing, that's what I would recommend to everybody.
Yep, that's wonderful. I love it. I love it. Such great leadership. Absolutely. So let's just kind of bust through these musical considerations very quickly, because a lot of this I think will be self-evident or will be in 10 years that you've done this a lot, right? So repertoire. What is the range of tessitura for each voice part? You might be able to transpose it. You might do some judicious rescoring, right? Where all your second sopranos are gonna become altos for just this moment and then go back up, right? Or however you wanna do that, right? Some of that rescoring, can help with that. Does it have interesting parts, right? Having your altos sing on middle C and D for 16 measures is really boring, and they're gonna sing it out of tune, there's no question, right? Don't do that with, that'll happen in a room of 18-year-olds too, right? So parts that are more melodic are easier to tune, they may stick in the memory a little bit better too. Rhythmic and stamina challenges, what are the challenges in this particular piece? Does it have a lot of dotted 8/16ths? Are you willing to accept that they might be triplets? The things like that you kind of have to think about. Stamina challenges for sure. You don't want to do Hallelujah from the Mount of Olives with a choir full of old people, because that's a lot of sustained high G, right? Eventually when you get toward the end. Appropriateness and relatability of the text is also really important. My choir of older adults doesn't want to sing Jesus is my boyfriend music. They don't, right? So I'm not choosing that for them. They just don't want to.
Sorry.
I love that term.
I survived the worship wars of the early 2000s. Yeah. Actually, I survived by leaving that church and going to a Lutheran church, where it wasn't an issue. Anyways, so when you look at a piece of music, really thinking about what the difficulty of it specifically is, right? What is hard about this? And this piece is too hard for my choir. Is it? What about it is hard, and how do you solve that specific difficulty, right? And are the difficulties a stretch? Like if I start this early enough, they'll be able to do it, and it'll be a really wonderful point of pride for them to have done this quote unquote difficult piece? Or is it an insurmountable obstacle that's just gonna make everybody mad and wanna go home, right? So you have to know your choir. You're not gonna know this with a choir if you just started a job. You won't. But you can learn. You might mess it up, and again, that's information, right? But certainly, when you vary the difficulty of the music that you plan from week to week, you can vary the difficulty as you move through your rehearsal. Presumably you do more than one Sunday's worth of music if you're a church musician, right? At each rehearsal. So if you're doing all screamers for 3 weeks in a row, you've got an entire rehearsal full of screaming, right? So mixing up the difficulty there, and also like the brain difficulty in addition to the physical difficulty. You mix it up from week to week, you can mix up your rehearsals as well. Unison and two-part music has a ton of value here. My favorite thing to do when someone asks me, what would you like to do for this church music conference or something? I'm gonna do a reading session of unison two-part SAB music. And I'm gonna structure it for the entire church year. And this is what I'm gonna do for you, show you what you can, that you don't have to do something in 4 parts to have a proper choir or to be an effective director. Sometimes you're a more effective director if you'll just program SAB, right? It's not worth the fight sometimes. Sometimes you'll do easy stuff for several weeks so that you can do you can do the big thing, right?
Yeah.
That is a stretch, right? And so you just have to know, you've got to think about it hard, you've got to look far in advance, which is really, really hard for church musicians. I totally get that you may not know who's gonna be here from Sunday to Sunday. That happens to me a lot here. Not that I'm bitter. I'm instituting a no ghosting policy this year. When you ghost me 3 times, I'm firing you, and that's, you heard it here first. But anyway, to the extent that you can, right? If you can get them to sign out on a calendar, right? So that you can plan these things, so much the better. If the difficulty of the piece is that it's just got a big moment of coloratura, can you just make that a solo? Why not, right?
Yeah.
Or do a small group. Again, as I said, balancing levels, types of difficulty. New music versus old chestnuts. Sometimes it's easier to learn a new vocal technique or improve your vocal technique on a new piece of music. Sometimes you'll pull out an old piece of music and they'll sing it like they're 30 again. So if there's a particular new thing that you want them to be able to do, if you've been working on vowels that have always been terrible and they've always had really bad oo vowels, you're not going to pull out Sicut Cherbus that they sang a long time ago, right? But you don't want we'll pull out the Palestrina with that text, but you might pull out something else that has ooh vowels in it, that's new, that doesn't have any of that old muscle memory wrapped up in it, right? And finally available in large print edition. A lot of new music is available in large print, and so if you can find it, if you can make it yourself, if you've got, you know, an office staff person who can blow things up for you while they're blowing up the bulletin already, you know, those are some nice things that you can do, that are just more welcoming to older folks. Because, you know, as I say, as I've been saying all along, we're not just dealing with older voices, but we're dealing with older human beings. And the vocal, you know, as singers, the vocal is tied up with the personal, you know, very much so. Your body is your instrument. Your body starts to not cooperate. It's hard not to just feel that everything is kind of deserting you. And so, you know, keeping that in mind, and thinking about all the different ways you can help. You know, if you're not a voice specialist, what are some other things you can do? You know, how can you attend to their emotional needs? How can you choose repertoire? If you're not going to be able to make all your soprano suddenly develop by A flats again, I mean, if I probably would try, because I have a lot of years of voice teaching experience. But if you don't have that, you know, you can do repertoire choices. You can congratulate them on that beautiful high F sharp, you know, right? So there's a lot you can do, and I encourage you to just keep trying, you know, and then find some friends you can go have a coffee with or a beer with or something like that, just to commiserate sometimes, because it's really hard work that you're doing. Very important and very hard work. I want to thank you all for listening and for bringing so many awesome ideas and questions. Peter, thank you for inviting me to come and speak. And I'm happy to stay in talk.